which is placed inside the uterus. The plastic version releases progesterone, which remember will stimulate the production of a thick mucus in the cervix. There's also a copper version of the IUD, but it doesn't involve any hormones. It just prevents sperm from surviving in the uterus by killing them. So even though we've included it on this page of hormonal contraceptives, do remember that the copper IUD, which is sometimes called the copper coil, isn't a hormonal contraceptive. And whether you look at a plastic or the copper IUD, both of these can last over 3 years. So as you can see, there are loads of different types of hormonal contraceptives, and they all work in a pretty similar way. The big difference is how invasive the initial treatment is, for example taking a pill versus having something implanted into your body, and how long they last, which varies from days to years. Our second group of contraceptives was the non-hormonal methods. What these have in common is that they all work by somehow preventing the sperm from meeting the egg. For example, condoms are worn over the penis, which traps any sperm. There are also female condoms, which are worn inside the vagina, but do basically the same thing. One of the important things about condoms is that they're the only form of contraception that also protect against sexually transmitted diseases, or STDs. Next, there's the diaphragm, which is a shallow plastic cup that fits over the cervix to block sperm from entering the uterus. Unfortunately, it's not that reliable though, so it has to be used with spermicide, which is a substance that kills sperm. Spermicides can be used alone as a form of contraception, but they only work around 7 out of 10 times, so they're not really that good. Now, a more drastic method is sterilization. In women, this involves cutting or tying the fallopian tubes, which remember connect the ovaries to the uterus. And so if they're cut, the eggs won't be able to pass from the ovaries into the uterus anymore. This is pretty much permanent though, so it's generally only chosen once a woman has had all the kids that she wants. Men can also undergo sterilization by having their sperm ducts cut and tied. Sometimes people use so-called natural methods, such as only having sex at certain times of the month, or stopping sex just before ejaculation. These are both very unreliable though, and not recommended. Of course, the only way to be 100% sure of avoiding pregnancy is by abstaining from sex altogether. And that's all the main methods of contraception. If you enjoyed it, then please do let us know what you liked and disliked down in the comments below, and we'll see you next time.
So you want to have sex, but how can you make sure you're safe? Contraceptives are methods used to prevent pregnancy and in some cases prevent sexually transmitted infections or STIs. Almost 50% of teenagers aged 15 to 19 have experienced sexual intercourse. However, only about 78 to 85% of them use contraceptives. Having unprotected sex can put you at risk of unwanted pregnancy or contracting an STI. This video will review common methods of contraception, how they work, and how effective they are. Although there's lots of different types of sex, this video pertains specifically to penis and vagina sex. Contraceptive effectiveness is assessed in 2 ways: perfect and typical use. Perfect use is the use of a contraceptive exactly as the manufacturer intended. Typical use factors in human error. Typical use would be like building a chair without following the instructions. It may turn out fine, but it may also break when you try to sit on it. There are 2 main categories of contraceptives: physical barriers and hormonal contraceptives. The first category is physical barriers. Physical barriers act to physically block the sperm from meeting the egg. A common type of physical barrier is a condom, which captures ejaculated semen. Condoms must be removed after sex and cannot be reused. There are 2 main types of condoms: the external condom, which is rolled onto an erect penis before intercourse, and the internal condom, which is inserted into the vagina and sits at the opening of the cervix on one end and covers the external genitalia on the other. This type of condom can be inserted 8 hours before sexual intercourse. With perfect use, the external condom is approximately 98% effective, and the internal condom is 95% effective. However, with typical use, the external condom has an effectiveness closer to 82%, whereas the internal condom has an effectiveness around 79%. Condoms can also greatly reduce the risk of contracting an STI, with protection being 85% greater in comparison to no condom use. Condoms can be purchased for a relatively low price without the need for prescription. The second category of contraceptives are hormonal methods. These methods involve two hormones that regulate the reproductive cycle, estrogen and progesterone. Hormonal contraceptives release either progestin and estrogen or progestin alone. Estrogen will prevent the release of an egg, so there's nothing to fertilize. Progestin will cause the uterine mucus to thicken and stop sperm from reaching the egg. Within this category, there are oral contraceptive pills, internal contraceptives, and transdermal contraceptives. It is important to note that no form of hormonal contraceptive will protect you against STIs. The first subtype is oral contraceptives. These include the combination pill and the mini pill. The combination pill contains both estrogen and progestin, while the mini pill contains only progestin. Both forms of oral contraceptives are 99.7% effective with perfect use and 92% effective with typical use. In order for either of these pills to be effective, they have to be taken at the same time each day. These pills are typically taken for 3 weeks and not taken for the 4th week. The second subtype is internal contraceptives. These include the intrauterine device and birth control rings. Intrauterine devices, also known as IUDs, are more than 99% effective with perfect use. They are T-shaped devices which are inserted into the uterus by a trained physician. There are two types of IUDs, hormonal and copper. Hormonal IUDs function by releasing progestin, while copper IUDs function by creating an inflammatory response in the cervix, which kills the sperm, and altering the cervical mucus to inhibit sperm motility. IUDs are reversible and can be used for up to 5 years for hormonal and 10 years for copper. Birth control rings are small, flexible rings that can be inserted into the vagina without a physician. They release estrogen and progestin and are kept in for 3 weeks and removed for the 4th. Birth control rings are 99.7% effective with perfect use and 92% effective in typical use. The third subtype is transdermal contraceptives, which includes the transdermal patch. The patch releases both estrogen and progestin and is applied every week for 3 weeks and left off for the 4th week. It is 99.7% effective with perfect use and 92% effective with typical use. Talk to your doctor to find out which hormonal birth control is the best for you. Emergency postcoital contraceptives, such as Plan B, can be used in the case where you've had unprotected sex or contraceptive measures have failed. Plan B can be taken up to 72 hours after the contraceptive failure or unprotected sex. Plan B works by preventing ovulation, and if taken within 24 hours, it is 95% effective. In summary, there are two main types of contraceptives, physical and hormonal. We have listed these contraceptives from least to most effective. As you can see here, the internal condom is the least effective, followed by the external condom. Hormonal contraceptives are very similar in terms of effectiveness and fall second only to abstinence from sex, which is 100% effective. In an emergency scenario, Plan B may be used, which is 95% effective within 24 hours. I strongly encourage you to practice safe sex by using contraceptives to protect against unwanted pregnancies and STIs.